Those who recently joined, please mention your course. If you belongs to BMS, BNYS under our system, which course are you in? Please mention. Okay. Okay. Thank you all for your response. I would suggest if you want to switch on your cameras so that we can speak with interaction, that will be more easier to convey the messages. So if you want or if you are willing to, you can definitely switch on your cameras and be attentive. I'll be very happy for that. Because our system is like this, okay, live demonstration sessions will be there because it is online platform. Once the courses are beginning, we'll be having like all the sessions will be live demonstrative and people will come with their videos on. Okay, that is our system. So if you are willing at present to switch on your cameras, then it will be very good. And so I will not take more than 30 minutes, just another 20 to 30 minutes I will be taking from your time. So I want to convey one of the finest secret in BNYs or in the field of ICE itself, can be for any of the streams of ICE. They will get this unique technique which can apply in their clinical practice, will give them the best result out of the current situation. Okay, so for the treatments available, if you can mingle this with the current unique theory which I'm going to say, then definitely you will be one of the finest practitioner in your entire field. Okay, that is how the course is been structured. A kind of single unique theory I'm going to share with your people. So for that, I'll be giving some introduction about that. You may listen. This won't be a waste of time. Definitely, it will help your future to become bright. Okay. So let me start. So pulse diagnosis is the one we are looking for. It's been a trend at current scenario. Why it is trend? Because people seek for instant remedy and effective remedy, right? Those people don't have much time to wait for their ailments to cure. So for that, one of the finest technique called pulse diagnosis could help them to diagnose them more easier and faster way. Along with that, they can correlate it with different treatments modalities that are present in each of the systems. Can be Ayurveda, BAMS, or BHMS, BNS, BUMS, anything. Okay. So all the system treatments, method of treatments can be absolutely correlated to this kind of unique, structured, unique theory. So once the theory is been very flourished, then you will definitely get the choice to link it with the different modes of treatment that you are going to practice. That is what the main agenda of our course is. Okay, so what is this pulse diagnosis? Actually, it has got a huge varieties of diagnostic tools. Okay, even in Ayurveda, Nadi Chikitsa, okay, Nadi Pariksha is one of the way of understanding the pulse diagnosis. Then in traditional Chinese medicine, it is there. Even in Unani system of medicine, it is there. So different Ayush systems are actually correlated to different kind of pulse diagnosis technique. Okay, even homeopathy, how it is been related to this pulse diagnosis. We have never found in homeopathy people are using all pulse diagnosis to make their treatment protocols, right? But there is a hope and chance to make medicines out of this theory. Okay, that is a primary thing we have to focus. The uh, basic concept which I will be sharing you can be connected for making medicines. You can treat in case of if you are choosing acupuncture, that is definitely well and good first option for treatment. Then massage therapy, and then cupping therapy, then supplementation, nutritional and dietetics. So everything can be connected to those. If you are taking the cases of Ayurveda people can connect it with different panchakarma chikitsas. Okay, pancha treatments are there. So those treatments are actually modulated from this basic concept. So people have forgotten this basic concept and have gone to beyond its level to a greater significant scientific evaluation. But fortunately or unfortunately, they have forgotten the basic theory. So that the treatment is going sometimes a random technique of administration. People sometimes get the result, sometimes it is not. But it should not be the case if you are administering the right and best treatment protocol. Okay, it should have some direction in your practice. Okay, if you are opting a treatment, that treatment should hit the target. That should be our motto. Okay, before you are administering the treatments should hit the target. For that, what you have to do, the disease should be associated with this cause that you have to understand. So the cause is the one we can diagnose with the pulse diagnosis technique. Okay, so pulse diagnosis can show a wide varieties of disease conditions, ailment properties or characteristics. For example, you can identify the genetic predisposition present in the patient. Okay, whoever it is, their genetic code is being permanently, not the point, permanently it is been uh, noted under their pulse. Okay, so it will never change. It will be keeping on present throughout their life. Okay, until they die, those genetic code sequence will be there imprinted in their pulse. Okay, so genetic modulations or genetic predisposition, what all chances of genetic condition they can happen. Maybe it is of diabetes from their parents, hereditary factors. Everything can be identified by this single tool. Okay. Then next one is the present state of their emotional as well as the bodily and behavioral changes. Whatever the physical ailments are there, or mental, emotional associated ailments will be, or the conditions will be reflected in the pulse diagnosis. So at the first level of the pulse, there are 7 different levels of pulse that we can go through in deep once we are into the course. So the first level denote the present situation, whether they have got some pain or subjective feelings, whatever is there, that will be reflected at the first level. Okay, then if it is resolved at the present situation but can be triggered in the next moment when some triggering factor is there, can be from external or internal, so that also can be identified by going to the next level. So likewise, the present situation can be understood. Then what? You can identify different tissue ailments. For example, the system wise, if you see, you can treat the conditions of vascular system, blood vascular system, then respiratory system. Already we told about CVS, respiratory system, then musculoskeletal system, CNS, central nervous system, everything, because all the seven tissues which is present, saptadhatus, they will tell in Ayurveda. So that those tissues are distributed at certain levels of this pulse. So that can reveal you what is the present state of that pulse, whether it is creating some illness based on Vata, Pitta, Kapha, one of the finest treatment theory which is present in Ayurveda, which can be similarly applied in traditional Chinese medicine as well, even in Unani pulse diagnosis technique, we can be correlating this. So finally, what you will get is, believe me or not, you can treat whatever the nervous conditions. For example, even if it is of some kind of chronic patients, okay, chronic pain, radiculopathy pain, or neuropathy, or even some conditions related to blood, like anemia, very chronic conditions like anemia, even some conditions like platelet disorders, or we can treat the musculoskeletal conditions where it will be causing some muscle related issues, okay, like myasthenia gravis, or the fibromyalgia, even rheumatoid arthritis, even though it is said to be incurable disease in modern conventional medicine, at an extent of uh, and at an extent we can give very good instant remedy for those patients if they are coming with pain. Okay, instant remedy means a single technique, if you apply a single technique, can give up to 60 to 80 percentage of relief at that moment. That much sharp is this technique. Okay, it's based on acupuncture. Even if you choose hijama, that means the cupping therapy treatments, or massage treatments based on manipulative therapy based on this, that also will give immediate effect for them. For that structural and very directional treatment protocol we should have, that is what we are going to teach in this. Okay, then what else you can obtain from that? You may get the sometimes, in case of homeopathy people, if you see homeopathy people almost ask more questions while they are taking case histories, right? That gives them more clarity to get into the diagnosis. Those are questions which is being exactly related to this Vata, Pitta, Kapha, or this Tridosha theory, or Saptadhatu theory which is present, and according to them, even mental illness or mental behavioral changes has got much priorities. Those also can be correlated to this. That is why the medicines which are being taken in the form of any tablets or any oil or anything, that can be prepared out of this concept. That is what the best and best point or quality that I have found in this year. Okay, that is one of the other property we have. Okay, then you might feel this is been teaching in online. Usually what happens is people will opt for offline sessions for getting this best pulse diagnosis and its associated uh, studies. Okay, but here what we are doing is, we are creating an environment where, which will actually give you a likewise the offline. Okay, nothing more or nothing less, you will get absolutely what you are required in this course through online itself. That is what we are providing: live demonstrative sessions with interactions. Individually I will pay attention to you, and I will ask you to check your pulse, and I will tell the symptoms or the things you have, or the ailments or conditions or the qualities of the pulse, maybe the rate, depth, volume, force, strength, everything based on your symptoms. If you say, then I could say this is the thing. Okay, and even for, for the first few sessions we'll be discussing about the pulse qualities. Once the qualities are being in your mind, then definitely I will ask for, if you are getting these qualities or not, then definitely you will reply me, yeah, I am getting this quality, or I am not getting this quality. Then based on that I will tell you what all symptoms you have, what all you don't have, what predispositions of genetic factors or hereditary factors you have, if you don't have. So likewise, very structural method of learning we will provide in this. Definitely you will get very best result, 100% result. No one can give this much assurance once you are very interested and very willing to uh, grasp this kind of knowledge wisdom, which is been actually have got some scientific evidence. If you are seeking through the acupuncture part and all, acupuncture is based on acupuncture meridian system. This meridian system has got some science beyond the science which we have learned from our text. Okay, so that will be discussed in detail. There you will click in your mind something like, oh, this is the factors. Actually, why people are going to tell this as a pseudoscience? There is no point of telling that like this. Okay, likewise, I will teach you what is the science behind this, more acceptable science that is so far present in current scenario, with the research studies that I will be sharing with you, and even the acute, chronic, subacute state of disease can be identified even without the patients are being told to you. Okay, before that you can tell the patient, so that you can grasp the attention and catch their confidence, and they will get attracted to your skill. Okay, that is why even the burdens associated with that advertisement part also not there for our system. Once the patient has came, definitely that patient will continue to your treatment itself if you are giving this method of technique. That is 100% sure. So you don't have to spend much of time and money and your wealth, your time, your health, everything for spending the ads also. That is what I can give assurance for you. So I want you people to build a community in the sense, this is being the first to introduce in India, maybe in the world, I don't know about. In India, for sure, this has been for the first time, because I only invented this technique, and nobody has got this unless the previous batch session peoples are there. Those people have this, and rest of the people don't have. So the narrow spectrum practice it is, and the scope of the disease, the scope of the treatment or scope of the system is very broader, very broader. You will definitely catch your practice into a better fine-tuned structural way once you enter into your course. So if you want to know about any more things about our course, you can ask definitely at present also, or you can text your messages, and I will tell the fee details and everything, the course fee and all. So this is what ultimately our course is being scheduled. So 3 months course will be there, 3 months. For example, if you are conducting the session 2 days per week, okay, maybe in Monday, maybe in Tuesday or Thursday, or another batch will be run parallel to that, that is Wednesday and Friday. So likewise, 2 days will be there in per week. Okay, 1 week will be 2 days, and 1 hour session, 1 to 1.5 hour session, 9 o'clock to 10:30 will be our sessions going on, and you will get the access to ask any doubts in between or at any time, and we will be completely guiding to you. And I'm making one community based on the people or the doctors who are there with this knowledge and flourish their knowledge to the current society and making their values and their cause recognized among the society. Definitely people will come to you, people will attracted by you if you are giving them the right protocol treatment. Okay, there is nothing like chances are there, but here it is your choice. If you select the course, if you give the right treatment to your patients at the right time, at the right quantity, at the right method, you will get the right result. Definitely. That will be easily grabbed through this unique single theory that I'm going to say. So no streams of ice are being separated from this. All of them can join, all of them will get the result. You will be even will have the position to make medicine out of yourself. And even if you are just completed the degrees, definitely without thinking to the second option, you will be able to start your own clinic soon after this course. No one or no course will be providing you such an assurance. So I'll be giving you this assurance if you are regularly participating. One more thing, if you have any issues with attending the sessions, you may priorly inform us so that our team can give you the recording session. Otherwise, we will not promote daily based recordings and all. So if you are missing some classes, definitely we will be providing the recording sessions. Okay, so the fee is coming like actual fee is 15,000, but we are making it for you people if you are there in this. And just the next till the June 2nd we have time to join. Before that you may contact us or make messages or DM us if you are joining or interested to joining or not. The fee now is the early bird offer we are giving at 7,999. Okay, 7,999. So the cost demand is getting little better for at from current situation. Okay, because uh, people are wanting this thing very much and they are interested to this, and so that you don't have to miss out the chance, I generally speaking, because sometimes after all if you are trying for next to next batches, the fee may be changing. Okay, so that don't think that this is the kind of information from ourselves. I will hope all you people are, if you are interested, then you will be getting to enroll. We will give complete guidance for that. So this is the fee structure. So I will give you the right time till June 2nd. If you are joining, you will be getting this at 7,999. Thank you so much. If you have any doubt regarding this course, then definitely you may ask. Even if you can ask with your mics unmuted, you can ask. Otherwise, you can give the messages in the inbox. Okay. Hope you are clear with the concept what we are trying to convey you. If you are interested, you can choose and we'll learn together. We'll make a better community out of this and we'll make it recognizable. Okay, our system. Thank you so much. Anybody if interested, please DM. We will guide you properly. Any questions you can ask. We have a lot of case studies also. If you want, I will be telling all those conditions, all those conditions got cured within span of just one or two sittings, maybe three sittings and all. Chronic conditions also being cured in such a way. Okay, so I'll be definitely speaking on that. Okay. anybody has any doubt, please go for clearing at present only. We will be starting our course in coming first week itself mostly. The first week itself, the first batch will be, means upcoming batch will be starting. Okay. Thank you so much. If you have any doubt, you can ask. Otherwise, we shall wind up our session. Thank you for joining till the last. Okay, thank you so much. Have a nice day. Goodbye. See you. Thank you so much.
Bye, Rahil.
Goodbye. Goodbye. Thank you so much. Hi, Sinjana is there.
Yeah, I just joined now. I was not knowing you have the class.
How are you? How are you?
I'm good. How are you?
Good. Okay. Where are you working now?
Doing- I'm working cruise ship.
Where?
Cruise.
Cruise ship. Oh, best
As an
opportunity. You want to try this again? This is kind of little
academic,
bit different system we are teaching. Okay, not like the previous one.
like
This is
how?
somewhat structured one. Okay.
Like yeah, I saw the pulse diagnosis, but I want to know more about this pulse diagnosis.
Yeah,
So
sure.
that's why I just.
You can contact me. I will give you the most details, whatever you want. Okay.
Yeah,
What
sure.
do you want to know actually?
Um, Usually, what I learned in my acupuncture course, it's
Yeah.
it's just the previous one you were teaching, right?
Mm-hmm.
Same it is, but I couldn't make it out when patient comes. I couldn't make it.
Yeah, yeah,
What is the
yeah.
conditions
That was
according
the
to the disease? Because
problem. It's even at the time when I was teaching you, even I had some of the like
uh,
randomization in treatment systems and all.
mm-hmm,
Actually, I got it cleared once I completed two batches. Okay, after two batches are finished, uh, before that I could make out one structured system which can help you definitely once you complete the course. Okay, even don't have to spend much effort also to diagnose it. So
mm-hmm.
diagnosis, even in the treatment procedure, can be easily
Now,
done.
if I learn a new things in acupuncture, I'll get messed up. You know why? Um, what I learned is like five element bases and
Yeah,
five shoes, and then what is that? Yin and yang, all
yeah,
those things. When it comes to pulse diagnosis, there are also multiple diagnosis through pulse diagnosis, right?
yes, yes,
Also, there is a tongue diagnosis.
yeah, yeah,
I can make it a tongue diagnosis, but when it comes to pulse, when deep, all those things are there, always get shuffle.
yeah, yeah. You get the doubt, right? Yeah, confusion.
Yeah.
Yeah. So actually, this is because once you learn only based on TCM, that
Mm-hmm.
will create you much into trouble. Okay, because
Hmm.
only TCM will be very difficult to grab, and it has been a very vast area
Yeah,
where
yeah.
sometimes some disorders can be very difficult to identify, and even if you can identify something, that will be mostly related to some acute conditions, sometimes chronic conditions, and that acute condition itself sometimes the intensity may not be able to find how much it is. Okay, so there are many complications like drawbacks once you select only TCM. That is why
And also,
I
it takes
started,
more
yeah, I
time to
started
heal.
mingling both Ayurvedic and traditional Chinese medicine. So Ayurvedics give more emphasis on the diagnostic part, and diagnosis is better, easier in Ayurvedic format rather than this. So I opt
So,
Ayurvedic pulse as the diagnostic tool, and treatment is coming like ultra. Okay, and the newly like I have added up something which is based on TCM, which will give the better option for your treatment part. Okay, treatment part will be better if you choose in case of TCM based protocols.
what I'm asking is like, see, so
Sorry.
now what you're doing is like you're adapting Ayurvedic medicine or Ayurvedic diagnosing part. Are
No, no,
you?
no. Medicines in the sense, if you want to make up some medicines, you can make based on this theory. Okay, there is nothing like some plants you can choose, or vegetables or fruits, like whatever the diet is there, you can choose and make it some powdered form or something for making medicines. That is one option is there.
What
Other than
I'm
that,
looking.
best result is given, and actually the instant remedy is always I will opt for acupuncture. Nothing can
Yeah, that's what I
overpower
need
this.
actually, because I am working in a cruise ship, only option is acupuncture
Yeah,
or else
acupuncture
Chinese
only you
medicine.
can choose
There is no
to.
option of Ayurvedic medicine, only Chinese medicine and the acupuncture. I need to get a result within one session because I need
Oh,
to impress
definitely,
the.
sportly you can get. Okay, so span of 2 seconds. As soon as you finish the treatment, just within two
Mhm.
seconds you will get the result once you recheck the pulse. Okay, the pulse will come back to whatever you have desired priorly, and so that you can tell the patient before only, hey, buddy, this is going to happen in your body once I prick, then definitely that will be hitting on that. Those people will get that result spot, and they will tell you back, oh, I got that relief or cure. That is what you can means, you can reconfirm it by checking it again, so that pulse will be changing its quality. So those quality
So by
variation.
changing the tools and also that's gonna help you to release the acute symptoms, right?
Sorry.
You said by instant result,
Yeah,
it's gonna change pulse and also the symptoms what they're suffering, right?
yeah, subjective feelings, right?
Okay. So if they take
Not only subjective
something,
feelings, objective feelings also, like if it is chronic. Okay, chronic, you may have
yeah.
doubt. I already told in the beginning of the session, there have been some like pulse diagnosis can reveal the present state as well as the predisposition state. Okay, like if something has triggered just recently in the past, or if something is tend to trigger in recent past, or uh, just within 2 days or something, recent span of time, they got any disorders or ailments or conditions, symptoms, that also can be revealed from this pulse reading. So you don't feel like only acute symptoms can be cured in this. Okay, even chronic
Mm-hmm.
also you can cure. For example,
How do you select the
very
points? Is
basic,
it based
yeah, very
on
basic
how?
thing. One thing I will tell, allergy will be almost chronic conditions. Okay, allergies. Okay,
Yeah.
respiratory allergies or nasal polyp. Nasal polyp allergy is most easily treatable disease. Okay, just to one sitting you will get the patient relief from the congestive nose, and even the running nose, even just the pain associated with that frequent sneezing and cough. Okay, so
Mm.
those allergies can be definitely controlled with just one sitting. That is possible in this way of technique. Okay, so don't have to feel like only these acute symptoms of stomach pain, headache can be treated through this. Even chronic
No, I
conditions.
used to get the patients of, they're complaining about the most of them knee pain, like
Yeah,
osteoarthritis,
knee pain is
shoulder,
the
shoulder,
best thing you will
musculoskeletal.
get if you have the chance to give knee pain treatment. What you can do is, one thing is, you can adopt two ways. One is just acupuncture you can give if they had recent like acute symptoms. If they have acupuncture only, you can select. if they have some uh, like OA mostly there will be disintegration of the bone cartilage and all. So for that, a period of time will be taken. Okay, period in the sense for each tissues, according to Ayurveda, each tissues has got some period of time where the immature cells are getting converted into mature cells. Okay, so until then you have to wait, but treatment can be given at once only. Okay, but the time if it has got like the time is been over, the very next day you can ask the patient, or the patient can call you or may contact you, and they will tell definitely they have relieved the pain or not. Okay,
Okay. So it's gonna reduce inflammation
it
also.
will it will reduce in that case. Okay, so for
Okay.
example, for bones and all,
How about the
almost
autoimmune
if you
conditions like
give first
osteoarthritis,
treatment,
gouty
okay,
arthritis?
if you give treatment for bone degeneration, for example OA,
Mm.
so
Mm.
20 days it will take for immature oocytes to become mature. Okay, sorry, this one bones cells to become mature. So for that, you have to wait for another 20 days. If they have any instant to or any chance to meet you again, you can give another more sitting session for those patients itself. Okay, otherwise one thing you can do is some adjustment adjust like something adapting treatments can also be applied. For example, if you have the idea what is the cause of this OA, and then something will be there as food items or some packs, cold pack or heat pack hydrotherapy measurements or something like hot bags or something. Whatever treatment at this like adjoint treatments you can adopt, then you can tell that patient you can do this home remedy so that you will get faster remedy or relief from the symptoms. Okay, so don't have
Mhm.
to feel like I will not get results when the patient is missing from me. Okay, nothing is there. Just one sitting is far than enough to get a better result.